Good afternoon. My name is Wendy Hetherington, and I'm Chief of Epidemiology and Program Evaluation for Riverside University Health System Public Health. And today I'm going to talk to you about how we report and confirm COVID deaths. But before I do that, I would like to take this time to acknowledge the 1,789 individuals who have passed away from COVID this year in our county. Every single one of those individuals is someone's mother, grandparent, friend, colleague, loved one. And my heart goes out to you if you lost a loved one this year to COVID. What we do is we use the Council of State and Territorial Epidemiologists case definition for what is counted as a COVID death. And that is someone whose final cause of death is COVID, or COVID is a significant contributing factor leading to that death. How this works in Riverside County is every week we receive a log from the Riverside County Sheriff Coroner's Office with the list of individuals who passed away the previous week. We also work with our Office of Vital Records as they record every death within the county, including COVID. And so what I do as the epidemiologist is review those death certificates and review the coroner's log to make sure that the individual meets the case definition of a COVID death, and then I confirm that death within our state reporting system. I would like to talk to you now about 3 examples. The first example I'm going to talk to you about is a 51-year-old male who died with no underlying conditions. His final cause of death is listed as acute hypoxic respiratory failure due to pneumonia, due to COVID-19, and as I stated, no significant or underlying factors. The second example is a 48-year-old whose final cause of death is also COVID-19, but this individual also had some significant conditions that contributed to that death, including hypertension, diabetes, and obesity. The third example is an 80-year-old whose final cause of death is listed as cardiopulmonary failure due to acute stroke. Other significant conditions that contributed to death are COVID-19 and chronic kidney disease. And all 3 of those are counted as a COVID death. We do not report and confirm people dying of COVID if they died of another cause in which COVID did not contribute to that death. For example, if someone died due to a car collision or a drug overdose or cancer, that death is not counted as a COVID death. So I hope with this video, it helps answer your questions about how we count and confirm COVID-19 deaths in our county.